Hello, everyone. Today I am talking about light therapy for eczema relief. And this is a question I get a lot. Does red light therapy help? Does blue light therapy help? What about far infrared? What about near infrared or UVB? So, today we're going to break all of that down for eczema people. I want to let what is the science behind all of these different light therapies? What's the difference between all of them? And how can you use them to help with eczema relief, both immediately and for lasting relief? So, I hope you're going to join me today so that we can really break this down. So, we are going to first talk about what light therapy is. I'm going to break down the different wavelengths. We are going to talk about each of the different types of light therapy, the pros, the cons, the science behind using these light therapies for eczema. And then I'm going to break down some of my recommendations. And then after that, we are going to answer questions and you guys can ask me anything. So please go ahead and type into the comments box throughout this process so that I can answer those questions at the end. Okay. All right. So, first of all, what are the different wavelengths and how do they affect the skin? So, when we're talking about blue, red, near, or far infrared light therapy, we're actually talking about different wavelengths. And blue light is between 400 and 495 nanometers. And this primarily affects the skin surface. This will affect the inflammation on the surface of the skin and then bacteria as well too. So this can be really helpful in an eczema case when we're thinking about infections like Staph aureus or even in acne patients. Red light therapy is between 620 and 700 nanometers, and this reaches a little deeper into the dermis or the skin to stimulate healing and cellular regeneration. Near infrared light is going even deeper, 700 to 1200 nanometers. This penetrates even further, targeting muscles and deeper tissues to reduce systemic inflammation. And then this also supports tissue repair. And finally, we have far infrared, which is 3,000 to 100,000 nanometers. And this delivers thermal energy into the skin and the underlying tissues. And this really improves circulation, it reduces stress, and these can be triggers for eczema. So each of these different wavelengths of light are going to affect our eczema differently. And so we can use these different wavelengths at different times in our healing process and for different reasons. So let's break that down. So, blue light therapy, one of the main reasons I like to use blue light therapy is to kill bacteria. And there are studies that have shown that blue light can kill Staph aureus. And this is a common bacterium that is found on the skin that can really trigger flare ups and worsen inflammation. And as a lot of us eczema patients know, we know that staph infections are something that might happen frequently. Blue light therapy can really help for this. But that's not the only thing. Blue light can also reduce inflammation, suppress those cytokines that cause us to be really itchy, like interleukin 4, interleukin 13. And these are really key drivers that, even our medications like Dupixent are targeting. So blue light therapy can be a really safe alternative for this. And you can also be supporting that skin barrier by doing both of these, right? So if you're keeping those infectious bacteria low and you're reducing the inflammation, that's really going to support a strong skin barrier. So blue light therapy, I really do like because the safety profile is pretty high. And there are some studies that back this up specifically for eczema. So a 2016 study published in Dermatology demonstrated significant reductions in eczema severity after blue light therapy. And most importantly, there were no adverse effects reported. And this just highlights how safe blue light therapy is. And it's a really great adjunctive therapy to add into your healing regimen for eczema. There was also another study that was published in PLOS ONE that highlighted blue light therapy's ability to improve eczema symptoms, including the reductions in itchiness and better sleep quality. So I like blue light therapy for eczema because there actually are specific studies that do back up this therapy for eczema. And we'll see some of these therapies don't have specific studies that back up the therapy for eczema, but they can back up some of the root causes of eczema. So I do like blue light therapy because we actually do have some research behind this. All right, moving on to red light therapy. How does this work? Well, red light therapy goes a little deeper, as we said, and it can boost cellular energy. That increases the little batteries that are in your cells that are creating the energy, fueling cellular repair and regeneration of your cells. So, this is really important because when we have eczema, we're creating a lot of wounds on our skin when we're scratching, and we need that cellular repair so that we can heal faster. So, my patients often tell me, oh, Dr. Fong, I know that I'm healing now because I'm just healing so much faster. Like I might have a flare, but then I heal so much faster. Red light therapy can speed this process up. It also reduces inflammation as well, lowering pro inflammatory markers like tumor necrosis factor alpha and interleukin 1 beta. So, we're also seeing that inflammation process being lowered by red light therapy. Collagen can also be stimulated, and that's the same thing as boosting the cellular energy. Not only are we boosting those cells to heal, we're also boosting the skin's ability to create that collagen and rebuild that barrier because that's really important. And then we're also improving that blood flow to the skin. It allows more oxygen to be delivered to the skin, allowing more nutrients to be delivered so that the skin can heal faster. Now, one thing that I have noticed is sometimes, using red light therapy is amazing. And then sometimes it can cause a little more inflammation when people are maybe a little bit too inflamed at the very moment. So it can go either way. And sometimes it's also the length of time that you're actually using the red light therapy that can also matter too. So I do sometimes like to use red light therapy when we are more in the healing process of the skin. And so for eczema, there's different stages that we go through. We have that really high inflammation. Then we might have that stage where we are flaking and that redness is coming down. And during that phase, it might be really great to use something like red light therapy to really help that regeneration of the skin. And then if we're going to think about using blue light therapy, we might be thinking about that when we are having flares, especially if those are being caused by infections like Staph aureus. Okay, so there's different reasons to use these, and so I will use these throughout a treatment plan from start to finish. I may actually use different types of light therapy as we're going through the process. Now, there are some studies that actually, have been done for eczema specifically in red light therapy. So, a clinical study reported 79% of eczema patients experience a reduction in itchiness, and 71% saw improvements in rashes after undergoing red light therapy. And then there was an animal study that was done in 2021 that demonstrated that red light therapy at specifically 650 nanometers significantly reduced skin inflammation, skin thickness, itchiness, and mast cell counts in subjects with atopic dermatitis. Now, mast cells are, these are immune cells in your body that release histamines and release all these inflammatory factors that cause you to be more itchy. And so often in an eczema case, we're seeing that there are high histamine levels. So that can be really important. The researchers from this study concluded that this treatment might be an efficacious, safe, and steroid free alternative therapeutic strategy for the treatment of atopic dermatitis. So, this is a wonderful, again, safe treatment that we might want to think about when we're thinking about our eczema treatment plan. Then there was one more study that was done where they saw that a combination of red light therapy and a a herb called curcumin, or it's actually from turmeric, and curcumin is actually the active component of the turmeric. Now, this is an anti-inflammatory herb that helps lower inflammation, produce the best results. So what it can show is that red light therapy along with anti-inflammatory therapies can actually be helpful for each other, supportive for each other to lower that inflammation. And they did notice that it was more beneficial to use them together than either of those alone. So using curcumin alone or red light therapy alone, they saw a benefit when those were used together. Okay. Now, the next type of light therapy is called near infrared light therapy. And this one's a little different. We don't necessarily have very specific studies on near infrared light therapy and eczema, but we do have some research that shows that it can help some of the root causes of eczema, like inflammation, and it can support things like detoxification and tissue repair. And as we know from previous episodes, that toxic burden is a big part of eczema, inflammation is a big part, and then, of course, that leaky skin. So, near infrared light therapy can be helpful. And there was research published in the Journal of American Academy of Dermatology that found that a combination of red and near infrared light therapy improved tissue repair and inflammation. So, I do really like it's a device called the MitoRed device, and it actually has a combination of near infrared and red light therapy. So I like using those together. Sometimes I will actually ask the patient to use the red light therapy first, and then when things are getting better, add on the near infrared light therapy. And the reason for that is it goes a little deeper, it can stimulate a little bit more, it's a little hotter, so the patient may tend to sweat when they're doing the near infrared light therapy. And of course, as we know as eczema patients, when we're sweating, we get itchier and sometimes it's a little more difficult. So I sometimes have them use the red light therapy part first and then later combine the red light therapy with the near infrared light therapy. All right, moving on to far infrared light therapy. Now, far infrared light therapy is the same thing. There aren't many specific studies for far infrared light therapy alone to support eczema, but if we're thinking about what far infrared light therapy does, it can target those root causes of eczema. So it improves circulation, it reduces inflammation, it supports the skin barrier repair, and it reduces stress. And as we have talked about before, stress can be another one of those big root causes for eczema that we need to address. So there were studies that kind of showed that all of these things are demonstrated, in clinical research. So a study published in Biomedical Research demonstrated that far infrared light therapy improved wound healing and reduced inflammation by enhancing blood flow and cellular activity. And then there was research also that showed that far infrared improved skin hydration, elasticity, and barrier repair, and lowered cytokines, including TNF alpha and interleukin 6. And finally, there was a study that showed that far infrared light therapy reduced stress and improved immune balance. So there's a lot of research actually for all of the benefits of far infrared light therapy. And actually, there are more benefits, cardiovascular benefits, etc. But today we're more focusing on the eczema part of things. Now, far infrared light therapy, you're often going to hear of it as a far infrared light sauna or a far infrared light sauna blanket. And so the reason for this is because it's going to go deeper. You are going to get hotter when you are doing this therapy. And it is a sauna therapy. And so, I do, again, like to reserve this type of therapy for later in the process because as we know, in the very beginning, eczema patients are often so itchy, so uncomfortable that this heat may not be helpful for them. And I remember when I had really severe eczema, it was really hard for me to get into a sauna. Nowadays, I love getting into a sauna, and it's when those toxins are really, overflowing in your, what I like to call again, your detox funnel. And I refer to that a lot. And when you have so much inflammation on your skin, sometimes that heat can actually increase the inflammation, even though there might be processes that are lowering the inflammation with the far infrared. Sometimes it's just not right to use at the beginning of the process. Okay. So, even though I'm saying, yes, this is great for eczema patients, it may not be right for you if you're having a really moderate to severe situation. And we might need to do more healing of the root causes before we actually use the far infrared light therapy later on in the process to really help with the detoxification and healing process that we might do later on in the process. And for me, detoxification is actually phase 3 of a support system. And we always have to start with the core organs, the core deficiencies, the nutritional deficiencies. We have to support those drainage organs. And then finally, we have to go ahead and cleanse the system. So I like to use this in that third phase. Okay. Now, how does this differ from UVB therapy? So, if you have been, maybe your doctor has told you about this type of therapy, it's called UVB therapy. This is a little bit different. UVB rays are doing two different things. They're actually suppressing the immune system and they're slowing skin cell growth. And so UVB reduces the activity of those immune cells, such as your T cells. And so this can really help lower that inflammation of eczema. And then it decreases that rapid production of skin cells, which causes the scaling and the plaques that you might experience with eczema. So it can help to alleviate some of those symptoms when there's a really moderate to severe, condition. But there are some risks. There is a risk of DNA damage, so that ultraviolet light can cause mutations in skin cells and increase the risk of skin cancer. So this is just kind of like going out in the sun and not wearing sunblock. It's like going in a sun tanning bed, and not wearing sunblock. And so you're getting that UVB direct to your skin. It can cause premature aging. So prolonged UVB exposure accelerates that aging process. Again, it's just like being out in the sun too much. And then it can cause some short-term side effects like redness, sunburn-like reactions, and increased sensitivity to the sunlight, because it's basically like you are sun tanning when you are doing this treatment. Now, there are reasons why we might want to choose these other light therapies because they don't come with these risks. The red, the blue, the near, and the far infrared are not ultraviolet, and so they are non-damaging to your DNA, and so that eliminates that risk. There are a lot of holistic benefits as we broke down. So it's not just about healing the skin, superficially. What's happening is actually lowering the inflammation and decreasing stress with these other types of light therapy. And then it really does promote that skin barrier repair because we're stimulating mitochondria, we're stimulating collagen, so we're doing this in a very holistic way. It's very safe for long-term use, so you can use these for a lifetime if you want. And actually things like red light therapy are used for anti-aging, and even the infrared saunas are great for anti-aging. And these therapies can actually be complementary to the other things you're doing. So, there's not necessarily any contraindications, although there are some contraindications with, certain diseases and certain medications. So you want to look into that. If you are going to be thinking about these light therapies, just make sure you're checking in with your doctor. Okay, so what are my recommendations? Well, I wrote a blog on this topic, so definitely check out the links in my description for the blog because there will be links to all of my recommendations here. I like red light therapy in lots of different ways. So if it's primarily on your face, you might want to get a face mask. I do really like the Mito Red because it's not just red light therapy, but it's a red light plus near infrared light therapy. And I will show you what my setup is at home. I have both a face mask and I have a pretty intense setup at home. And then you can also there are handheld light therapy machines that have both red and blue, and you can switch between those, especially if you're having infections on your skin and you're worried about staph infections. You can go blue, and then afterwards you can go red. You could do 5 minutes and 5 minutes daily, something like that. And then there are full body machines that are for red light therapy. And I'll show you what mine looks like. There are full body machines for the far infrared. There's far infrared sauna blankets, far infrared saunas that you walk into. I actually have both of them. There's also PEMF mats, and we didn't talk about PEMF or pulse electromagnetic field therapy, which I also love, and I'll probably do a separate session on that. But there's PEMF mats that have infrared in them as well too. So you can check out all of those recommendations in the blog that I wrote. And if you have any questions, definitely just comment on the blog, reach out to me. You can DM me on Instagram at drfong.nd, and you can ask me any questions you have. And if you are live watching this right now, go ahead and write any questions you have in the comments, and I'll be answering those in just a couple minutes. So this is my setup at home, if you guys can see it. If you guys are listening to this on the podcast, what we are looking at is we are looking at an elliptical machine. So I've got an elliptical machine, and I actually have my red light therapy machines kind of flanking my elliptical machine. And I actually wear goggles when I do my elliptical machine. I turn on the red lights, and I do this for 20 minutes every day. And this is a great way to get both the red light therapy, the near infrared, and get my exercise. And because it's getting colder, it allows me to get some of the healing benefits of the sun because I'm not going out in the sun a lot. And it feels like that. It kind of feels like I do it on an incline, so it feels like I'm trudging up a mountain in the sunlight. It actually feels really great, really energizing. I feel really awesome after I do this. So you don't have to have this setup, but I just wanted to show you what my setup looks like. And it is a quite an expensive setup. So, you don't need all of this, but these are the Mito Red panels. So you can actually get Mito Red panels that are going to be encompassing your entire body. You can also just get panels that are smaller, if you're concerned about cost. And then you can just rotate the areas that you want to put the red light therapy on. I do typically recommend that you start with just, 5 minutes in each area, or even 1 minute if you're very sensitive. And then you can go up to, 15 to 20 minutes if that's something that your body can tolerate. But I do always recommend that you build up to that, and that you work with someone to make sure that you're doing this correctly, and you're not necessarily contraindicating with anything else that you're doing. All right. Well, thank you so much for joining me in this conversation today. Just so you know, there are a bunch of resources that you can access if you do have eczema. So you can get my free eczema relief guide. Just DM me, or just look at the link in my bio. And this has a bunch of resources if you are suffering from eczema, so that you can get some lasting relief naturally. And then if you are interested in booking a one-on-one consultation with me, you can use the code IGDC30 to get 30% off. We do have a money-back guarantee. If you have any questions about this, just DM me, and I'm happy to answer any questions for you. And the link is in my bio. You could also DM me if you'd like the link directly. All right, it's time for questions. I do want to remind you that everything I talked about today is for informational purposes only. This is not medical advice. If you are interested in medical advice, definitely think about booking a consultation so that I can evaluate you individually. But I'd love to now answer any questions you have about light therapy and eczema. How do we heal eczema, and relieve our symptoms with light therapy? So if you guys have any questions, please go ahead and type into the chat box now. And again, I'm happy to answer any and all questions about light therapy. Someone's asking, why not red light with higher power density laser, deeper penetration, less damage controlled? Okay. So that's going to be different. We're talking about red light therapy, just either 630 or 650 nanometers is really what we want. With laser, we're going deeper. We're doing other things. So that's a different type of therapy and a different potential result. Okay. So we're talking about really just using the specific nanometers of the red or the blue light therapy in this process. All right. Okay. If you guys have any other questions about light therapy, please type them into the chat box. If you don't have time to ask your questions now, just DM me, and I'm happy to answer those questions on Instagram. And if you do want to dig into this deeper, I can send you the link to the blog, or just go to the links in my bio and you can find the link to the blog there, because I do break down all these studies. I also break down all of my recommendations. There's links to all of my recommendations. And since we are approaching Black Friday, I thought this would be a good topic to talk about because these devices are not cheap. But with Black Friday, maybe you can get some additional discounts. Okay. All right. I don't see any other questions coming in. So if you do have any, please go ahead and type into the chat now. Otherwise, thank you for joining me today. This will be posted on my Instagram. It will be posted on my YouTube, and it will be on my Live with the Eczema Doc podcast as well. Next week, I usually release it the following week. Okay. And someone is asking, I have a red light device. How often should I use it? So, again, this is going to be different for everybody, and everybody is going to tolerate it differently. So, I typically recommend starting really low, 1 minute to 5 minutes, and you can try to do that daily, and you can see how that goes for you. Then you want to just increase by 1 to 5 minutes, potentially on a daily basis or every 3 days. And you can go potentially up to 10 to 20 minutes, depending on what your goals are, depending on if you're noticing improvement. There's a lot that's involved. And so when I'm working with my patients, we have a journaling system where my patients will actually log this into the journal. And so we might be watching what they're doing if they're using a red light therapy device. And then, as I mentioned in the episode today, sometimes it's not the right time to use the red light therapy. Sometimes you need to do the red light therapy a little bit later in the process. Sometimes you don't want to do it currently because you're just too inflamed. The red light therapy sometimes lowers that inflammation, but sometimes it does increase that. So everybody's a little bit different. So everybody has to give it a try. And sometimes if you try it and you're just experiencing too many flares from it, it might just not be the right time. And then you could hold on to that device and then use it later on. Okay. Is red light same as vitamin D from sun? It is not. So what stimulates vitamin D is the UVB, ultraviolet B rays. That is what I was talking about for UVB therapy. It is not the same as red light. Red light is not stimulating vitamin D. Red light is stimulating, ATP production and energy production in your cells and collagen stimulation and things like that. It is not stimulating vitamin D. Okay, so there's a distinct difference there. So it's not the same as going out in the sunlight. So you do want to still go out in the sunlight. Okay. Is red light best for winter blues, collagen production, and better skin overall? Just bought a Loom box. I believe a Loom box, if I'm correct about this, and I might be wrong, but I believe a Loom box is actually it's mimicking sunlight. So there's likely some red light in there, but it's not a full red light. If I'm correct, I might be wrong. And that is great for winter blues when you're not able to get out there in the sun. So that's a different reason for using that. And it's still great. If you are not getting out there in the sun, you can then get your vitamin D stimulation and all of the other rays of the sun, including, including potentially, if I'm thinking of this correctly, there, that you're getting some of that stimulation like the sun in the Loom box. But red light therapy, again, is a little different, and it's got to be red. So if your Loom box is red, then I might be wrong, and that could be red light therapy. But red light therapy is not necessarily going to fully chase the blues away like, sunlight would. Red light therapy is mostly kind of stimulating tissue, cellular regeneration. Again, it's more at the superficial level. And if you want to go a little bit deeper, you could go with near infrared or far infrared and then go out there in the sun, would be another thing you could do. But, doing these light therapies are kind of taking a component of what you're getting when you're out there in the sun. Okay. Great questions. If you guys have any other questions about light therapy for eczema, please go ahead and type into the chat box now. That's what we're talking about today. I'm happy to answer any and all questions about light therapy for eczema relief. So go ahead and type your questions if you have any. Otherwise, I hope you guys all have a wonderful holiday. And thank you for joining me today. And I hope that, for Black Friday, this is something you might think about if it's not something you have already. And so you could check the links in my bio for my product recommendations. You can also go to my blog, the blog is going to have my light therapy recommendations. It's also going to have some links and some discount codes. And then additionally, I think these companies are also doing, Black Friday specials as well too. So it might be a good time to think about this if eczema is something you're dealing with, and if it's something that you wanted to try and just see how it could help. Again, this is not. I would say light therapy is not going to stand alone. And most of the therapies don't stand alone. And what I mean by that is you still have to work on the internal system and working on lowering inflammation internally. You cannot just do light therapy and think that your eczema is going to get healed. And it depends also how severe that eczema is. If it's just a small spot, it's possible that red light, blue light therapy can help. But but this is a great adjunctive therapy to use. And it can, yes, someone's asking, does it help with the itch? Yes, it can help with the itch. It can help lower inflammation. It can help if you keep getting staph infections, but it does take some time. So you do have to do it, daily or a couple times a week. And, if you're tolerating it daily, then it can be helpful to do it daily. And I have had patients tell me that it has helped lower the itch and help, even almost with immediate usage. So, I do like to reserve it sometimes for different parts of the process, but it can be really helpful when we are wanting to regenerate, new cells, when we are trying to lower inflammation, and when things aren't too severe. I noticed that it works better. Okay. All right. Any other questions, please go ahead and type into the chat box. Again, we're talking about light therapy for eczema relief today and what foods can trigger eczema. Okay. So, it's a little off topic, but it's a good question because, as I mentioned, light therapy is not going to be the only thing that's going to help you. For every person, what triggers your eczema is going to be different. So, it's not exactly an easy answer to answer that, but I will say that there are 3 top foods that I would say can trigger eczema. And for me, in my patient population, almost across the board, gluten, dairy, and sugar are triggers for eczema. And when I test people for food allergies, food sensitivities, the gluten and dairy often do come up as sensitivities that we need to pay attention to. So, I can't answer that directly, and I can't answer that for you. What I would say, how do you answer this for yourself? Well, we could do some testing. So we could do some testing to see, first off, what does your gut health look like? Do you have something called leaky gut? For this person who's asking this question, I might recommend you do my free eczema root cause assessment. You can go to the link in my bio and find that link and take the assessment to see what root causes are you dealing with. And if you have leaky gut come up as one of the root causes, it's possible that you also do have food sensitivities, because along with leaky gut, you're going to potentially have more sensitivities to foods. And so then we can test you and see what those food sensitivities are. And with that, we just need to do some trial and error to see, okay, if we remove these foods, do things get better? And then, can we heal that leaky gut? And then later on, we can reintroduce those foods. So our hope is that you don't need to have such a restrictive diet for the rest of your life. Our hope is that we heal your gut so that you can then potentially start eating those foods again. Maybe not in a high amount, but, moderating your consumption of those. Okay. Any other questions? Go ahead and type into the chat box. Can light therapy be used on infants? So, I would say I would feel more comfortable if you are working with a practitioner, if you are going to use light therapy on your infant, so that your practitioner can give you very specific recommendations as to how long to use it for, how far to put the light away from the infant, how, it depends on how old that infant is as well. Infant skin is very uh it's very delicate. And so, you don't want to overstimulate it necessarily. So I would say this is a difficult question to ask, to answer without saying that you should probably be working with someone if you have an infant with eczema. And unfortunately, it's a huge population I work with because there's so many infants that are being born with eczema nowadays. I just did a podcast and a blog on the eczema epidemic as to why this is happening. So if you didn't check that out already, definitely check it out. I dive into why there's so many infants that have eczema these days. And so it's a large population of my patients is actually infants who have eczema. So we may not use light therapy in the very beginning. We may reserve it for later on, because maybe it can sometimes be too harsh, too stimulating sometimes on some babies. Is light therapy covered by insurance? So I do believe that if you have like an FSA or HSA, if your doctor recommends it, you possibly can use your FSA or HSA to cover these things. And when you actually go to the link in my bio, go to the blog, and if you click into the ones that I recommend, a lot of them I do think say FSA, HSA approved or something like that. So, but no, it's not going to be covered by insurance. But if you have a flexible savings account or health savings account, you may be able to get it covered that way. But these are not like UVB therapy, which is prescribed by your doctor. These are home therapies that you would decide to do at home that are typically out of pocket. But if you do have FSA, HSA, you may be able to use those funds for this. Okay. All right. Any other questions, please go ahead and type into the comments box. I'm happy to answer any and all questions. Um, uh, you know, it can be a great therapy. I would say again, one more time, it doesn't stand alone, but it can be helpful. And people might say, oh, I did notice that my skin got a little, it relieves the itch a little bit, or it helps my skin to heal faster. But it's not going to work alone. Nothing is going to overcome or replace you working on what I call the pillars of health, which is eating clean food, having a clean environment, having a clean fitness regimen, having a clean routine, and having a clean mind. Nothing replaces that. And for me, those pillars of health are typically 75% of the journey that you need to really overcome. And then the rest of it is, okay, how do we help that journey along? And if we identify certain burdens or imbalances, then we need to, we do need to address those individually. But, light therapy is only part of that plan. Okay. If we are recommended UVB therapy, do you recommend trying it? So, as I mentioned, there are risks. When you do UVB, it's almost like you're doing a sun tanning bed. You're having the same risks of being in the sun for a really, really long time, having DNA damage, potentially having skin cancer, a higher risk for skin cancer. So I do believe that there are a lot of possibilities before you even do UVB therapy. And these light therapy modalities are one of the possibilities. But the real, way that you want to treat it is you have to treat the root cause. None of these light therapies are really, truly getting to the real root cause, which is your internal system. I like to say you're driving around your car, the check engine light comes on, you take it to the mechanic, and the mechanic gives you something to just put on the check engine light. And that's what some of these therapies are like. That's what UVB therapy is like. You're just silencing, the symptoms at the top. But we need to go in, we need to pop the hood, we need to check the engine to really understand what's going on inside the engine. Okay. So that's where we really need to dive into. So I would say UVB therapy, again, even by itself is not going to stand alone. So if you are thinking about trying it, if you do it along with thinking about the root cause, working with a practitioner to think about the root cause, then that could be a little bit different. But if you're just thinking about doing it alone, not doing anything to change diet, to understand what your root cause issues are, I would say that, it can provide relief potentially, but it may not be lasting relief potentially. Okay. But it can be really useful in a very moderate to severe situation. And sometimes people do really notice a lot of relief in a moderate to severe situation. If your eczema is more light to moderate, I would say I don't know if I recommend UVB. I don't know if the cons outweigh the pros. Okay. Tanning once or twice in the winter seems to boost my mood and make my skin better. I don't believe that has any UVB lights, though, correct? Where would I get the UV lights? Okay, so when you tan once or twice a year, in the winter, you are getting some UVB rays, I believe, because I would say that I don't really know much about tanning beds, to be honest, but there should be some UVB in there, and then that may be why you're getting some stimulation of vitamin D and some of the anti-inflammatory aspects of that. And should we do it in conjunction with red? Okay. So again, this is something you have to talk to your doctor about because it might be too much stimulation on your skin, and the UVB by itself can be more harsh. And so I may not recommend doing multiple light therapies if you're already doing UVB. We know our root cause, or one, is mold, and we have MCAS. If you guys don't know what that is, that's mast cell activation syndrome. So right now he's super sensitive. Is this something that could start the process of healing? Okay. It's a possibility. I would ask you, how are you treating this mold? How are you treating the MCAS? The red light, blue light therapy could lower inflammation, but it depends how triggered he is. Did you say he? Yes, he. How triggered he is, and um, if he gets triggered really easily, sometimes the light therapies could trigger this also. So um, it's hard to say without really diving in and evaluating this case, individually. And I would really want to know how you're actually treating the mold and the MCAS. Um, I would say this could be helpful and adjunctive, but it's more important to understand how you're actually dealing with the mold and the MCAS to really get to the root cause and really start the process of healing, if that makes sense. Okay. I went to a dermatologist appointment today and was told food can't heal diseases. My daughter has atopic dermatitis and they want to put her on methotrexate. I'm so sorry that you were told that. I'm going to tell you a story really quick. I wanted to be a dermatologist. I actually went to UC Berkeley. I was pre-med. I was preparing to go to regular medical school, conventional medical school. I was working with an awesome dermatologist. And I mean, he's really, really great. And I asked him, I said, I noticed that when I eat this or this, I get itchy. And I said, can food trigger my eczema? And he said, no. He said, no, the studies don't show that. And intuitively, I just couldn't believe this. I couldn't believe that this would be true because I could feel that when I would eat something, I would get stimulated and I would have a flare. And it would be a direct, like right afterwards, right? Um, so at that point is one of the reasons I actually shifted gears, because I knew intuitively that there were more answers here. And I'm going to tell you right now, if we choose one thing to heal our disease, it would be food. The way that we heal, the way that even anything happens in our body is with building blocks. And where we get those building blocks from is food. Right? I mean, we also get it from the sun. We get some vitamin D from the sun. We get stimulation from the sun. But food is a huge place where we get these building blocks from. So if you're being told that food can't heal disease, I mean, I don't know personally, if I would continue down that path with that practitioner from a personal place, me personally, just because I know that this is not true. And a lot of disease is one, you don't have the nutrients to heal. Then some diseases, you have all this burden, which can come from food too. Food is something we put into our mouths 3 to 5 times per day. You can either choose to eat poison or you can choose to eat, medicine. And that's your choice. So sometimes you don't know you're eating poison, and that can be the problem. You don't know you're eating this poison. And so, you might be eating things like, I mean, even just eggs. Let's say eggs are an allergy for you and you just don't even know it. And that could be poisonous for you. And that could be stimulating inflammation and you just don't know it. So I would have to very much disagree with this practitioner that you saw. And I will want to tell you, if you go to my, okay, let's see here. Where can you go? If you go to my blog, I did write a blog, and I have a guide about the risks of conventional medications. I would highly recommend you read that and read about methotrexate. This is not a light drug to give your I think it was your child you had said. And there are side effects. And this is not a long-term answer. So we need to start really asking, why do I have eczema? Let's stop just taking conventional medicines that are just silencing those symptoms and causing more side effects than we really need. And let's use medicine that heals, and let's get to the root cause. So if you want to understand what the root causes might be for you, take my free eczema assessment, and you can understand, what the root causes are for you. And in each of those sections, I break down, what are the different things you would do. You would get some testing, and you would, and how would we treat it, and all of that. And that's all broken down there too. Okay. So I know I got on my soapbox for a little bit, but I feel very strongly about it because for 25 years of my life, I was suffering because my doctors never told me any of this. And now I'm eczema free. And, the only reason I'm there is because one of the reasons is because of food. So I want to say that food, that's, in my opinion, in my experience, personally and clinically, this is not true. Okay. Is red light therapy different than infrared red light heat therapy? Okay, so I broke this down in today's session. So I'm gonna post this. So just watch the replay. Also, go to my blog and you can read it. It's all broken down. Yes, red light therapy is at a different wavelength than infrared. And when sometimes there are saunas or infrared therapy where they combine it. They put the red light therapy in the sauna. So my sauna, for example, has red light therapy in it, and it changes colors at the top. And that is using both. Okay, so it's using infrared, and then there's red light. And then I also have the red light with the near infrared light. So sometimes they combine these. And then in my sauna, I can turn off the red light if I want to, et cetera. So these are not the same. Infrared is not the same as red light. Okay. I'm so sorry to hear that they were so dismissive for you. And unfortunately, this is a problem. This is what's happening. And that's where, as a doctor who now treats eczema, it's my goal to reverse all of this. It's my goal to really be that partner for my patients, because I feel like a lot of the doctors, they're almost, and I hate to say it, but a lot of they're drug dealers. They're giving us drugs, and they're not necessarily getting to the root cause. And that's not everybody. So I'm not making a blanket statement here, but there are, a lot of dermatology is take this medication, use this topical, do this injection, take this oral medication. And it's not, hey, let me delve into your life. Let's figure out what's going on. And one of the first things I do if you are booking a consultation with me is you get access to my journaling system. And in my journaling system, you're going to give me information on, pictures of your food, pictures of your skin, pictures of your poop. And then I'm going to look at those, and we're going to delve into your life, because it's not just labs that's going to tell me the answer here. It's also, what's actually going on in your life. And so that's really important for me. All right. Well, everyone, thank you so much. It's been such a wonderful session. Great questions. If you guys have any questions, you can further questions, just DM me. But also, I have a lot of free resources if you do have eczema. So definitely check those out in the link in my bio, or just DM me and I'm happy to send them to you. Okay. I hope everyone has a wonderful Thanksgiving. You're very welcome. And I do this every week. Today was a little earlier. I normally do this at 12:30 on Wednesdays, but I have to go on a plane to go see my family. So I needed to do this a little earlier this week. And again, you could check out all of this on my YouTube, on my Instagram, and then my podcast. If you haven't followed that already, it's Live with the Eczema Doc. All right. Thank you so much, everyone. And again, I will see you next week.